When I was a child and in the neighborhood where I lived, a small health post was opened. It was a very simple place with a waiting room and an office where the doctor would attend to anyone who needed it. The people of the neighborhood loved the novelty, and soon more and more people began to attend the health post. There were days when the post was empty and no one showed up. Other days it was crowded and it was a mess at the door to know who was going to be attended first. The doctor was losing his hair to manage so much confusion. To better organize the service in the health post, the city hired a receptionist. Her job was to receive and register the patients, schedule the appointments, organize medical records, and these administrative things. With the arrival of the receptionist, the service has improved a lot. All that work was before done by the doctor, who now had much more free time to devote to his patients. Besides, the receptionist was a very organized girl and left all the paperwork in order. However, when the city hired a nurse to help with the doctor's work, the change was not so easily accepted by the community.
I'm not going to let this girl give me an injection. She's not even a doctor.
The people in the neighborhood were used to being treated by the doctor at all times. They had confidence in him and at first became suspicious that the nurse would not be able to give the same level of care. But over time, they realized that the nurse had other skills. She was nicer to deal with people, bandaged carefully, seemed to have more empathy with patients. We were convinced that she was applying the injections even better than the doctor. Each one takes care of its own specialty. He made the diagnosis and indicated the treatment. She applied the treatment and took care of the patient. My neighborhood grew and also grew the health post that eventually became a huge hospital. Today, in addition to general practitioners, the hospital has ophthalmologists, cardiologists, gynecologists, geriatricians, pediatricians, and several other specializations, in addition to several other types of professionals. In the health post, if you had an eye problem, the general practitioner would treat you as everyone else. Now, at the neighborhood hospital, you will be treated by an ophthalmologist who knows much more about this specific subject and can give you much better treatment. The growth of organizations naturally requires a specialization of roles and the distribution of responsibilities to provide more quality services to their customers. Notice this change in the organization where you work. Identify the size and maturity level and try to organize the work in the best way to serve your customers.